In a lot of parts of the world, aerobic exercise should be delivered by physiotherapists, and that's what my research is about, whether physiotherapists are delivering aerobic exercise for their stroke patients. And we find that some physiotherapists don't have maybe the knowledge or skill in aerobic exercise prescription to use it for their patients. Some have barriers related to not having enough equipment or space, and some find that their patients, they don't think that it would be suitable for them because of comorbid conditions and concerns about cardiac conditions and safety of aerobic exercise. So our research was trying to understand whether physiotherapists are using aerobic exercise for their patients with stroke, and when they are, what is their general approach to using aerobic exercise. We did find that there was wide variability in what physiotherapists were using aerobic exercise. So in some settings, there wasn't any aerobic exercise being done at all, whereas in other settings, almost all patients were doing aerobic exercise. But in those settings where there was a large number of patients doing aerobic exercise, the intensity or the dose of exercise seemed to be quite low, that they weren't really prescribing a very challenging exercise intervention for their patients, or maybe the duration of exercise wasn't long enough. So the patients might not have been getting optimal benefit from aerobic exercise in that context. Whereas in settings where fewer patients were participating, those patients who did participate were doing a higher dose of aerobic exercise and were hopefully benefiting more from it. One of the concerns that we saw was the way the health system is structured, at least in Ontario, that it seems to prevent therapists from implementing best practices and implementing aerobic exercise. So we think that there need to be some systemic changes in order to enable therapists to implement best practices. And we also found that from the perspective of patients, the patients were generally motivated to do any intervention that the therapist recommended for them. So when the therapists were recommending aerobic exercise, the patients were pretty happy to participate. They want to recover, so they'll do anything that their therapist recommends. So that from the patient perspective, there don't really seem to be any barriers there. So it's really about trying to just get the therapists to implement more aerobic exercise for their patients.